Okay, I think we're going to get started and then as people come in. All right, hi everyone. I want to thank you all for coming today. My name is Maddie. I'm the Co-op Alumni Assistant for the Faculty of Health. I want to start today's session with a territorial acknowledgement. I'd like to acknowledge that much of the work of the University of Waterloo takes place on the traditional territory of the Neutral Anishinaabe and Haudenosaunee peoples. Our main campus is situated on the Haldimand Tract, the land granted to the Six Nations that includes 6 miles on each side of the Grand River. Our active work towards reconciliation takes place across our campuses through research, learning, teaching, and community building, and is centralized within our Indigenous Relations Office. Okay, so I'm so excited that you guys are here today for our last alumni office hour of the month. Today we are welcoming Rachael Cale. These office hours are a great way for us to connect alumni with students, which is really important to us in the Faculty of Health. Alumni help show students all the different paths you can take after university and show you that there isn't just one way to use your degree, which I think we can all agree is something that so many students are constantly thinking and worrying about. So we hope these sessions are helpful for you guys. I would like to say, since the point of these sessions is to connect and chat on a personal level, that if you can all turn on your cameras if you're able to, so Rachael isn't talking to a bunch of blank screens, that would be awesome. And when we get to the Q&A portion, feel free to use the raise hand function or type in the chat, I have a question, and I'll keep track of that and call people out. I think that's all for housekeeping. So I'll do a little intro of our speaker, Rachael. Rachael Cale is a certified child life specialist with a BA in Therapeutic Recreation from the University of Waterloo and a post-degree diploma in child life studies from McMaster University. Rachael is currently working for the Hospital for Sick Children, Child and Family Centered Care Department. She aims to help children, teens, and family cope with the stress and challenges associated with being sick and in the hospital through the hospital's internal television channel, The Scoop. Working from Marnie's studio, Rachael coordinates and facilitates live interactive television programs that provide fun and distraction, education, normalization of the hospital environment, and a feeling of community for patients. In addition, in 2021, the studio launched a new sister YouTube channel called The Scoop at SickKids. Rachael is also a recent recipient of the 2021 President's Award at SickKids for helping create a seamless child and family experience. Before her work at SickKids, Rachael worked as a recreation therapist at Roger Neilson House, a pediatric palliative care facility. Within this role, Rachael supported children and their families throughout the trajectory of their illness and after their death. Rachael's focus at Roger Neilson House was providing children the chance to experience a normal childhood experiences, as well as helping to build each child's legacy. After a child's death, Rachael worked with siblings both individually and in group settings, supporting them through their grief and bereavement. I'll now hand the floor or the Zoom call over to Rachael to fill in the details and talk a bit more about her experiences. Go ahead.
Hi, everyone. I'm Rachael. Thank you, Maddie. That was really nice. I first of all, just want to give a caveat that I might be a little bit struggling with words. My dog had a really big surgery yesterday, and I was up most of the night with him. So I'm going to do my best. I'm also in virtual SickKids land. I was hoping I would be able to show you the studio that I work in, but that's just life. That's how it rolls. So I think what I want to just speak until we get to the questions, I just want to first explain in basic terms what a child life specialist is and what we do. My sort of journey from Waterloo to where I am now, and then what a sort of a day in a life looks like. And I have a little video as well to show, a short video. So child life specialists it's a very interesting and small field. There are approximately 25 of us at the Hospital for Sick Children. And most hospitals, though, that aren't children specific have only about 1 or 2 or 0, some. But we are educated and clinically trained in the developmental impact of illness and injury on children and youth. And when I'm explaining it, my elevator pitch is kind of, to say it in simple words, is I like to use education and play to help kids cope with the experiences of being in hospital. A traditional child life specialist, I'm not my role is not traditional, but traditional child life specialists work on units or in a specific clinic in a hospital. So they often have a very specific population of kids that they work with, or youth that they work with. And they are helping with things like procedural prep. So walking a child through the steps of what to expect, helping to provide distraction and encouragement during a procedure. And that often that means like creating a plan and helping the whole team stick to that plan throughout, and then helping the child through. We also do a lot of education on diagnosis, teaching coping skills and non-pharmacological pain treatments. So that's a lot of like guided imagery and breathing and a lot of other things like that. And so that's sort of your traditional lens of a child life specialist. I am very much non-traditional. I work in our TV studio, which there, of all of the children's hospitals in Canada, we're one of the few that have a full-fledged studio. There are a few that do TV programming or like pre-recorded things that then are able to do more like media virtual style programming, especially since the pandemic started. People tried to do more of that. There are a fair number of TV studios in children's hospitals in the States. And that's where our sort of like grew out of the idea of my day in a life, or actually first I'll say the goals of our Scoop, of the Scoop channel. It's all about teaching coping skills, normalizing the hospital environment. So for a kid that, I mean, even for adults who, if you've never been in a hospital, it can be a really scary place and you don't understand it. There's so much lingo, you don't know what it is. Like a good example is if we tell a kid, go jump up on that stretcher, to a child's brain, they're like, wait, you're going to stretch me? Like, why am I going on a stretcher? So like a child life specialist job often is like, oh yeah, we're going to hop up on this bed that has wheels on it. They like to call it a stretcher. Isn't that a funny name? Like that sort of, we're like the translators. And our TV channel is able to do that for a large group of kids. Since there's so many kids, we have 420 beds, I believe, approximately at SickKids, and 25 child life specialists. So you can imagine we cannot serve every child, but the TV channel is able to be available to everyone. We also allow opportunities for opportunities to play and for kids just to be kids and sort of have those normal childhood experiences. So we do things like graduation ceremonies and school assemblies and birthday parties and our science field trip, those sorts of things that you might be doing in your community or at school. And then also, of course, distraction's really important, and empowerment. So we like to be able to show kids that look like them, are going through similar things that they are going through, and that are excelling at certain things. So we often have kids in who will like sing on stage, you know, sing the best rendition of Let It Go that they possibly can, and we'll film it and then show it to other kids, and they see, hey, that kid's singing on stage and has an IV and this and that, and that looks just like me. It can be really empowering for both the kid who's watching and the kid who's performing. And they can do a lot of other things. So I guess I'll do my story of how I got to where I am, and then I'll explain my day in the life. So when did I start Waterloo? 2009 was my first year at Waterloo. I was in the co-op stream TR, and I did a minor in psychology, which I really loved. And I had a number of really great co-op jobs while I was in school. And I think that that was a huge part of both discovering my passions as well as providing me with opportunities. My first job was actually in the, as we called it, AHS Dean's office at the time. I actually met Jen there, which was pretty cool. And since then have kind of kept in touch with the faculty because it was such a lovely experience to work as the front desk assistant. I also worked in a psychiatric hospital for adults in Hamilton, which taught me a lot about what I don't want to do, which was really helpful in that way. I'm not really both mental health care as well as adult care. It was not for me. I did a placement at Kids Ability, which was really, really cool, to be able to do a bunch of things like summer camp or like learn to ride a bike camp with kids. And I really liked learning about the interdisciplinary nature of the work that they did there. And then I did a leadership program where I helped with that. And then my biggest job, which really opened a lot of doors and taught me all about child life, was when I worked at Roger Neilson House as a co-op student for 2 semesters, 2 terms. And this is like where I found my calling. My supervisor while I was working there was a child life specialist and really taught me all about what child life was. And honestly, the second I heard about it, I was like, that's what I want to do. I knew I wanted to work with kids. And this just kind of pulled all the pieces together for me. Roger Neilson House is basically a hospice for children and youth. So many of which have very severe disabilities or illness. And so while I was there working as a rec therapist, I did both like recreation for kids who were getting respite care because they often had a lot of care needs. And then so they would come and give their parents a break basically by coming and staying with us. We almost like called it like a little cruise ship. And I was like the cruise ship director and we did all the fun activities, went to the park and it was a lot of adapting regular kid experiences for kids who were non-speaking, had very limited mobility. Most of them utilized wheelchairs. It was really cool. And actually I really loved working with that population of kids. And then of course we did bereavement groups for siblings who had lost their sibs. And I also did some work with patients who knew that they were going to die in the future and like some of that sort of work and a lot of memory building, legacy building. I know it's like kind of like a lot of people are like, what? How could you even possibly do that job? But it was such an honor to be a part of each and one of those family and child experiences and such a huge part of their life. So I really loved that. And after I graduated from Waterloo, I applied directly to the McMaster Child Life program, which at the time was a post-degree diploma. It is now a master's program. And it's the only program in Canada that allows you to go from graduating from your program and immediately being pretty much ready to be certified, other than writing the exam. You can do like an independent sort of process of trying to become, like you can take courses from different places and kind of pull it together, but getting an internship is almost impossible. So I always tell people like, don't do it that way. If you're ever thinking about it, don't do it independently because it's really challenging to get in. And it's such a small, tight-knit community that starting from a program like McMaster allows you to really network and meet everyone. And that's how you end up with jobs. And that's the reality of it. So I got into that program and I was able to do a placement both at Grand River, actually. I got to come back to Kitchener for a little while. And I did another placement at SickKids. And that's when I got to experience the TV channel. And that's sort of how I realized that was a super cool thing. I really loved it. And at that point, I didn't really know what I wanted to do because I was also working in the critical care unit and I was getting like hospice work and like end of life work and the trauma work that I loved, this like really heavy stuff, but I also loved the really light stuff. So I was trying to find that balance and I still love both of those things. But for me, the environment of the job that I'm in right now won out for me. Anyways, so once I graduated from McMaster, I was lucky enough to be offered by Roger Neilson House a job immediately out of school. which is one of those just amazing possibilities that happen with co-op. Is you make those connections and you make an impact on a place, and they know you're graduating, and sometimes they reach out. And so I was able to work there for 2 years, and then SickKids job came up. So I applied, and now I've been at that job for 5 years. So I feel like I'm talking a lot, but I'm almost there. We can do questions soon. A day in the life for me really revolves around our live TV shows. So we do 3 live shows a day in the studio. Our first one is story time for our younger audience. And all of these shows kids can watch on their TV channel, and they can also call or text at the same time that we're doing it. So there's a way to participate in every one of our shows. Sometimes they can win prizes. They can play the games with us. And I'll explain that a bit more in a second. But so story time is our little preschooler circle time hour or half hour. Then at 1 p.m. we do a game show. It's either name that tune, we do karaoke on stage, bingo, craft show, and something we put together that's Game of Games. It's like a bunch of party games like Pictionary and Taboo all intertwined. And then at 3 p.m. is my favorite. I get to do a Kahoot trivia quiz every single day. We do 2 quizzes with the kids, and it's actually really cool because then if they have a device in their room, they're able to log in and play along with other kids in the hospital, which has been so impactful, especially right now because all of our playrooms are closed. They have no chances to interact face-to-face with any peers, which in the past was such a healing and important experience for a lot of kids, to see kids that were just like them and play with them and talk to them and share their experiences. So this is our in-between. This is how we can still connect kids to their peers, their community, and build that feeling of community. So in between all of those shows, I have a ton of other duties. I'm coordinating in between upcoming collaborations, whether that's with community organizations. I've had the opportunity to work with a lot of celebrities, like in sports teams. So every year I work with the Leafs, the Raptors, the TFC for a visit. Like if we had Ryan Reynolds, Shawn Mendes, Olympians, Dan Levy, Chris Martin, which all of these things we're so lucky to have them to come in because of the SickKids name brand. But it's very interesting because we also have to balance at the fact that they are coming often not just for the kids, but for their own benefit. So it's advocating for the kids while still making them happy. And that really goes hand in hand with the fact that I also work with a lot of donors. We have a lot of donors coming through, and our spaces are completely philanthropically funded. My role is completely philanthropically funded. If we didn't have donations, we wouldn't have it. So I get to sort of work a lot with the donors and schmoozing and the foundation, which isn't probably my least favorite part of the job, if I'm honest, but it's a necessary evil. And then other things I do are like in hospital meetings. I go around to patient units to deliver prizes and interact with patients. I work on individual projects with patients, whether that's, performing on stage, to, some of the heaviest stuff I've done is I've filmed goodbye videos for a child who knew she was palliative and might not survive, to her whole family. So it's a really big difference in all of the different stuff we do. And then a lot of behind the scenes tech stuff. And you might be wondering, like, how did you end up in TV studio if you don't have any TV experience? I just love tech. And I've always loved tech. I didn't have a lot of like performance or TV experience. I did go to an arts high school, but I just loved it and was willing to learn. And they really wanted a child life specialist in the role because they knew how much we would be interacting with the patients. So that's how I ended up in it, which is kind of cool. And it was a brand new role as well. So I really had to design it and bring it to life in many ways. The TV channel still existed, but they wanted a full-time person focusing on it. So I know I've talked a lot, but that's sort of my spiel so far, but I'd love to hear your questions and answer any as well as I can. Yeah.
Thank you, Rachel. That was great. So yeah, we're going to move into like a Q&A portion. So if you guys can use the raise hand function, or just let me know in the chat when you want to ask a question. Again, if you can turn on your camera, if you haven't already and are able to, when you're asking a question, that would be great. Otherwise, if you aren't able to speak or unmute, you can type your question in the chat and I can read it out for you. Also, when you guys are asking your question, if you can just introduce yourself a little bit so Rachel knows who she's talking to, just like your name, year, whatever you want to introduce yourself. But yeah, so.
I also just remembered I was going to show a really quick video so that you guys
can
actually get a sense of what it looks like. I would just give it, so I'm not going to toot my own horn all that much, because I will say we are definitely between public access television and like a real TV show. We live somewhere in the in-between. So our quality, we're not doing versus campaign quality stuff all the time, but I'm going to show this little clip. This is actually, we just rebranded in the last year to call our channel The Scoop, and this was a promo for it. So I'm going to just share that really quick. Share the sound. Can you all see that now? Yeah.
A 1, a 2, a 1, 2, 3.
I'm so excited.
Hi everyone. Are you ready?
Ready!
Let's do
Hit it!
So I feel like that gives you a little bit more of an idea of what our show's like. Also, I think, is that Elizabeth? Hi, Elizabeth. Elizabeth was a high school co-op student with us in our spaces for a little bit, and then went on to TR.
Yes, I'm loving it. You recommended this program, and my goodness, it definitely is up to the hype that you recommended it too.
All right, 1 second. A video just started playing randomly on my computer. I'm so glad. Okay, I'm ready for questions now.
Oh, it looks like Emily wants to ask one. Go ahead, Emily.
Hi, so I'm Emily. And I'm just curious, like, how is the work-life balance of your job? Like, is it a lot to take home with you? Yeah, just.
That's a great question. I think at times, yes, it can be that way, that there's a lot that, I mean, you see a lot of hard stuff. You hear a lot of really hard stories and witness a lot of stuff that you wouldn't normally witness if you were at an office job. For me, I mean, I've worked in palliative care, so of course you're seeing a lot of emotion, and it definitely required me to do a lot of my own personal work to be able to process all of that and come to a place that I was able to understand, or I guess understand is not the right word, but how to just be with all of that pain. But really, I truly feel like the winning feeling over all of that is just how honored I am to be a part of those moments. And I've never sort of shied away from big feelings. However, I would say when I was going into my co-op job at Roger Neilson House, I was petrified. I thought there is no way I could possibly do this. This is crazy. I can't work with dying children. Are you kidding? And then I think if you're passionate about the work and you're the sort of person who likes to hold space for people when they're going through things, I think it's a really great fit. And I think you learn coping skills, and I think it's a big thing in the healthcare industry to sort of learn about boundaries and how to have them, and how to manage all of those feelings that you might have. And as time goes on, like I've been in this role for 5 years, I've been a child life specialist for almost 8. It becomes, I know it sounds kind of weird, but like it becomes normal to see these things. And I think, of course, there's still super emotional moments and you get sad and you cry, but also all of your coworkers understand that and are with you and feel the same things, and we support each other. And it's definitely ups and downs, I guess. But I would say my work-life balance is pretty good. In like, once I'm home and I'm focusing on my family. So.
Thank you.
Looks like we have another question from Brittany. Go ahead, Brittany.
Hi, I'm Brittany. I'm in my 4th year of Therapeutic Recreation, and I just wanted to know what schooling you did after TR to get into child life.
Yeah, so I went directly into McMaster's Child Life program. At the time, it was a post-degree diploma, so it was only a year, and a really intense year though. And now they have switched it to a master's program, so it's a 2-year, which I think in many ways is actually really nice. It's the first year is distance ed, so you can do it from anywhere. And the second year is your internships, so you have to relocate. It's unpaid, which sucks compared to Waterloo Co-op, but you have to relocate to different places if you don't live there to do those internships. But it's one of the most important parts of the program, I would say, both getting the hands-on experience and the networking. It's integral for getting into the profession that's so small. Yeah, that program. Thank you, Jen.
Thank you.
It's a great program. I really loved going through it. Yeah.
I've heard like, I was talking to someone that was a child life, and she said it's just really hard because there's not a lot of jobs in child life.
So yes and no. It kind of depends on, one of the big things is where you're thinking about living. That's
right.
The reality of it. McMaster University, or McMaster Children's Hospital Health, I think they call themselves Hamilton Health Sciences now, but the children's part, they have a ton of jobs. They typically have, I think they've got more than SickKids has, like 30 to 40 child life specialists at the hospital. SickKids has about 25. Okay. The one thing I will say is it is a very female heavy profession. So there are mat leaves all the time. And while it takes time to get in, sometimes there are jobs. Okay. I would say what's nice is that the program in Canada, it's the only one in Canada.
Right.
And they accept no more than 12 students a year.
Oh,
so
wow, okay.
Yeah, it's small. And to get in, you do need to have, though I think they're being flexible on this right now because of COVID, but you do need to have 100 hours of experience volunteering with a child life specialist. So okay. That can be done at a children's hospital, that can be done at a couple of community centers around. It's a bit tricky to find, but if you're really into it, and that's one of the things, they really want to find people who really want to be in the program, so that right. That the spots are going to people who really want to.
For sure. But you said with COVID that they're probably changing that a little bit, just because you guys probably aren't accepting volunteers, right?
Yeah, I'm not 100% sure what it is, but okay. I've heard they're doing things differently right now. Okay. So I would check out the website and see if they've said anything. I don't really know about that part.
Okay. Mm-hmm. Thank you.
No problem.
I feel like I just want to do a quick plug, because as restrictions are like starting to change, now might be the time to reach out to people to say you're looking for volunteer opportunities. And as soon as they become available, could you let me know? Like that sort of thing. Because if you do a little bit of that work early, then you might have a chance as soon as they can take.
I know right now at SickKids, we've just, our volunteer resources department has just sort of been given the green light to start to recruit volunteers for summer, but it's going to be a limited number, not as much as we usually have. And it depends on whether everything continues to open. We are slowly reopening the hospital a little bit. Right now, we had one caregiver per inpatient at a time, which was really, really challenging for families. And we're just going into 2 caregivers as of last week. And so we're slowly opening up. I can see the light a little bit from this Omicron darkness. So, yeah. I can't remember your name. I'm sorry. What was your name? With the hands up. Oh, Paige. I can put my mouse over it.
Oh, Paige, you're muted.
I'm Paige. I'm in my 2nd year of TR. And I'm just looking at the child life at McMaster, and it also says that there are prerequisite courses to get into the program. Do you know what program at what courses at Waterloo would be those prerequisite courses?
So I don't know what specific courses are still there, because obviously I graduated in 2014. But I know basically how I got all my courses was I did my minor in psychology, and I did as many of the psychology courses on children as I could, mostly because also those are the ones I was most interested in. So that's a big part. A bunch of your rec courses can typically go towards it, especially like facilitation or like any theories of play. I don't think maybe you might have something similar to that. Yeah. Like all of those are really anything to do with child development, anything to do with the healthcare system and working with working with people in healthcare. All of those are going to really help you to be a really great candidate. And I will say, I know, and I said this to you, Paige, earlier, I know that the Child Life program people that are recruiting and deciding who's going to be in the program, they know that TR is an amazing stream into the career. And so it really does prepare you so well, because a lot of what we do as rec therapists it's like a part of what Child Life does.
Yeah, for sure.
Hi, sorry. So my name is Katrin, but you can call me Kat. My hand up button wasn't working either. So you mentioned the Roger Neilson House, and I was hoping you could talk a little bit about that, because I've known about them for a couple years, and I've been interested in doing stuff with them, but I'm not quite at the level enough that they would have me come.
I don't know if they are taking co-op students anymore. I'm not really sure what they're doing in terms of people, how they're bringing people in. It's in Ottawa. I don't know if, just so everyone knows. There is a place that is similar to it in Toronto called Emily's House. It's sort of based off of a similar structure, and there's actually, I think, a few throughout Canada. So there's Connect Place in Calgary. No, Connect Place is in BC. Rotary Flames House in Calgary. And I think there's another one in Quebec that I'm totally blanking on the name of. But it's a really cool place to work. It's a very small group. It's like a house is what we try to call it. It's a little more institutional than a house, but we try to make it as homey as possible. There was a living room and kitchen, and a lot of other cozy spaces, and there's a big playroom. And then up on the top floor, there were a bunch of rooms. There were 2 family suites and then a bunch of single or double rooms. And the single double rooms were where a lot of our respite patients would be staying. So like I said, it's kind of like giving their families a moment to breathe, because a lot of them require through the night care, whether that's medication or, maybe they're a trached patient. So someone needs to be up with them all the time. So you can imagine how tired those families must be. So they can come and they get a certain number of hours per year that they're able to have their child, or number of days, I think, at this facility. And then the family suites often are where our families who are at end of life. So this is actually, I didn't explain this. Palliative care in children is very different than what you might think of with adults. Palliative care in adults is like end of life most of the time. Like we are at the end of the road and we are keeping you comfortable as possible until you pass away. In palliative care for children, we might know that you have a disease that is going to continue to get worse and worse, and know sort of your prognosis and where you're headed, that you're going to have a life-limiting illness. But that could mean you're going to live into your teens or even into your early 20s, but you could still qualify to be in palliative care. So a lot of these kids, some of these kids had been going to Roger Neilson House for like 5 years, 10 years. But we knew that they were on the pathway to having a shorter lifespan and had a ton of care needs and a lot of pain often needs. So palliative care doctors are sort of, their expertise is on keeping people comfortable and maintaining quality of life. So they would be part of a care team that was also providing like more intensive acute care as well. So it's like finding that balance. So sorry, I could talk about this all the time and I could get really into details, but at Roger Neilson House, my job was to provide the activity for the kids while they were there for respite. So, we would watch movies, we would cuddle. A lot of the kids actually needed like physical touch because, I had kids who were blind and deaf and developmentally delayed, that like physical touch was what they needed to be comfortable. And that was one of the lovely things about working at a place like this, was that we were able to be really like loving. Often in a public institution for healthcare, it's like, nope, can't touch you. Like, oh, you're hugging me. My arms are up here. But this place, because of what it was like, very much encouraged that. Of course, in a very professional manner. I know that might sound weird, but and so providing comfort, providing recreation throughout the day, and then also sort of providing these like bereavement opportunities for siblings. So whether I was supporting a sibling as their sib was dying, so walking them through that and just really holding a space for them. That's often what it was, or explaining what was happening. We did groups where we had a group of siblings who would come in once a week while their parents were doing a adult parent bereavement group. They would come and we would do lots of different activities and sort of facilitate some stuff just to like encourage conversation and teach some coping skills or teach some emotional intelligence skills so that they're able to communicate how they're feeling, that kind of stuff. And there's so many other things as well in that job. I really like jobs that are every day is a little bit different and are very hands-on, but still, and require a lot of creativity, but also have structure. And actually I found that the Roger Neilson House didn't have quite enough structure for me, which is part of why I wanted to move to the other job. Sydney, what's your question?
Hi there, I'm Sydney and I'm in my final term in therapeutic recreation. I have kind of a two-part question. So my first part is, how did COVID change your daily responsibilities? And then my second question was, you said that the patients can dial in to participate with the channel. And I was wondering, is this on video? How do they kind of participate? And is there like a big program that happens, or is it just strictly through the TV?
Okay, so great questions. The first question, COVID turned everything on its head. I work in an area called the family spaces. So we actually have the studio, as well as a bunch of different playrooms throughout the hospital that were group play areas. Obviously, all of those got shut down for group play. We were able to manage one-to-one play with one staff and one child, and then we clean for 15 minutes and then take another kid for another half hour and clean, and that was like the whole day. So my team, other people on my team had a much bigger change. My change was more that all of a sudden the TV channel was the only group programming available in the whole hospital, and we knew there were going to be so many kids who were going to be struggling to cope, didn't have caregivers who didn't really have a lot of support because family members were not allowed to come in. Siblings no longer were allowed to come in unless you had special exceptions. And that's still the case. And so we knew how important it was going to be for the TV channel to keep running and actually expand. So we went from doing, how many did I do? 9 shows a week that I was, 9 shows a week in the studio to now we're at 17. And that's been 2 years, but actually went from 9 to 14 shows in like 2 months. So it was a big shift in that sense. I also was at the time rebranding the TV channel, so that was a big job, and then was able to bring on another person onto my team. So I now have a person who works 3 days a week and helps with editing, because I wasn't doing any editing. And we need, I haven't said this, but in between all of our live shows on our TV channel, we play our replays or pre-recorded content. So that's in between that, there's all these other things that we need to be doing all the time to make sure that that channel is up and running and like fresh and interesting and to date. And it's a lot of work. So it was a lot. And also at the very beginning of the pandemic, every celebrity and their brother wanted to do something for SickKids, which was so cool, really awesome, but really overwhelming to have all of these offers of people being like, hey, I want to do this. Hey, I want to do that. Do you want to do this? And like, there were just so many people because everyone was stuck at home other than healthcare workers and like other essential workers. And so it was cool, but a lot of work. So that's kind of where we're at now. It's forced us to grow, and that's been really cool. It's been really rapid growth, and I'm really happy for that. And I think it also allowed us to reevaluate some of our practices and make them better. So that's the first question. Your second question was about interaction on the channel. So all of our shows are broadcasted through the cable TV onto channel 41 on their TVs in their room. That's the only way that they can watch our live shows and our replay shows. We do have stuff on YouTube that's some of our replays. And you can check that out if you ever want to, the Scoop at SickKids, SKOOP. And so they are able to call us on the room phone, because many kids don't have a device in their room, like a cell phone or an iPad. They can just dial 228-582 and a direct line into our studio, or they can text us now. We just recently, that was another piece of growth that happened, is they can text. We got a studio cell phone, which has been awesome because they can send us pictures of their crafts. Sometimes they send us pictures of their pets, and I'll share those on the channel. And also many of the kids don't feel well enough to call in and actually participate. And the way they participate in many of these things, like for example, our Game of Games show, we'll have a host on stage playing, 2 hosts on stage playing a game. A kid calls in, we spin the wheel, lands on Pictionary. The host picks a Pictionary thing and starts drawing on a whiteboard, and the kid's on the phone live or texting and is guessing what it is. And then afterwards they get to pick a letter for our word puzzle. And then as a group, we're solving this like Wheel of Fortune word puzzle throughout the show. So that's one example. Craft kits on our craft show get delivered to all the patients in the hospital. So kids watch our craft show and can craft with us, along with us, and send pictures. Bingo, everyone gets a bingo sheet and they're playing bingo along with us as we call numbers, which is still I mean, everyone in rec therapy knows people love bingo, and it is still the #1 favorite show, even though I'm like, I put so much effort into so many other things, and bingo stays #1, and I don't know why. We get double the number of kids playing for that. So that's how they participate. Paige?
Thank you.
Do you think you're able to reach more children in the hospital in your position now?
That's an interesting question. I think yes, I think so. Yes, actually, yes, I do think so. Our numbers have increased, and that's partially because we're able to do more shows. And one of our shows, especially our Kahoot trivia show, is attracting a whole population of kids we were never getting before. Our teens, like our young teens, the 13, 14, 15-year-olds, never participated before. Our average age was between 7 and 12, I would say, for most of our programming. But the second we started doing Kahoot, I was getting all of these like 13-year-olds like really engaged, and it was really cool. And that's become one of our most popular shows. And we have kids of all ages who play it, and often their parents play it with them in their rooms as well. So I would say yes, we do.
That's awesome. My sister actually like recently stayed at SickKids and had a surgery at SickKids. And like after this, I'm definitely gonna ask her if she heard of it or participated in it.
That is I will say that is one of our biggest challenges, is getting kids to be aware of our TV channel. I feel like it's the everlasting, even in rec therapy, getting people into your programming can be really challenging. Especially when you're at the hospital, you're sick, you have a million tests that you're coming and going, people coming into your room on and off. And then everyone else at the hospital who's coming into your room is so focused on your health. They're not going like, hey, watch this TV channel, have fun. And like, it has so many other important therapeutic benefits that people also don't realize, that we're constantly trying to educate other staff and promote to families that they know we exist, because also they're just getting bombarded with information the second you get into the hospital, that taking in simple things can be overwhelming.
Have you guys had to come up with ways to like, I guess, market the channel and promote it to people in the hospital?
Absolutely. And we're always trying to do better. And like, I've got a whole bunch of plans in the works right now to try and get more people to participate as well. But we do meal tray flyers. So kids get these meal trays with their food. We call it meal train because I don't know, they come on a train, but it's not really a train. I don't know. I think that used to be a train that it got brought on, but it's no longer. It is just called meal train now. But we print off flyers, and kids who get meals will get a flyer. But a lot of kids at the hospital don't get meals because they're waiting for a surgery and they're NPO, meaning they can't eat or drink, or there's a lot of babies at the hospital too, like a ton of babies. I think people never realize how many babies are at a pediatric hospital. I would say that's probably 50% or more of our population at times. So sorry, meal trays, screens around the hospital. We send out posters that go up on the units, child life specialists. Word of mouth is the best way to do it. I have little like promotional stress balls that are TV remotes that child life specialists can use, because stress balls are a really great coping mechanism or coping tool that they can use. And then it's also like, hey, check out our TV channel. It's constant, always trying to think of stuff. And also at the same time, navigate the red tape and bureaucratic challenges of working in a large, huge institution, constantly facing lots of challenges you wouldn't think you would face, especially for a TV channel. As like one of their biggest things is privacy and confidentiality, is maintaining that. That's one of the things that I feel like people don't think about right off the bat, but like I'm constantly dealing with making sure that we're managing people's privacy and confidentiality.
Rachel, I have just one other question for you. I'm just asking or wondering what your advice would be for somebody who hasn't like this is personally for me, like child life has been on my list for a while, but I haven't always been set on child life until recently. So I was wondering what your advice would be for somebody who hasn't always had this as a goal. And like my experience is more so gerontology and palliative care relation. So I was just curious as to like what your advice would be for somebody like that.
So I would say don't count yourself out, because any experiences in healthcare are so important, because not only is it learning about children and having experience with children, it's also understanding the healthcare system. And that's a huge piece that a lot of people who come into the program at first have not a ton of experience with. They might have a handful, but not a lot. So that's a really great thing. And you can really bring in a lot of the things you learn about in that into child care. I would say your biggest asset is going to be to volunteer as much as possible. Other places that you can volunteer that look really good on a resume would be places like camps that support kids with different illnesses. So there's it used to be called Camp Ooch, but it's now called Campfire Circle, which is for children with cancer. They do amazing programming, and I think they're recruiting for the summer volunteers if you're interested in anyone. They actually work within SickKids. I work with them all the time. There's Camp Erin if you're interested in palliative care and working with bereaved siblings, or not just siblings, bereaved children and youth. And there's a bunch of other camps. There's, oh gosh, I'm gonna forget what that camp's called, but there's a lot of other camps that will look amazing on a resume for applying to the program. Working with anyone with a disability is a benefit. There's just like, there's so many other ways. And I wouldn't say like, just because you haven't always been interested in it. I wasn't either, not until I started. I didn't know it even existed until my like third year, maybe, I think, until I did that co-op program job. So, and there's lots of people who go into there that don't have the same, like I had someone who did microbiology as their undergrad, but she still was in the program with us. So.
Okay, thanks.
Yeah.
I'm just gonna look at some of the questions that have been submitted.
Oh, are there questions?
Oh, this one's a good one. So, I mean, you've talked about even when you were in university, how when you were taking psych courses, you always took ones related to children. So I guess, what is it about children? Like, what motivates you to work with children over any other age group? I guess, what do you like about it? Why is it so special to you?
I've just always loved children. I think children are the good in this world. The getting to witness their lens on the world is such a joy for me. Seeing how they see everything around them, also just like the funny stuff that comes out of their mouth just makes me so happy. I love that they're creative, and the world hasn't sort of trampled the creativity out of them yet. I also think another big part of it, and this comes with my personal work, and this is a little personal, but I'm happy to share it. As a child, I felt like I didn't have someone who heard me or understood what I was going through, and I felt quite alone. And I think that I feel very passionate about supporting children so they feel less alone through experiences. And particularly such scary experiences as being in hospital or being very sick. And so being able to be that person that provides that comfort and that just understanding, someone who can translate what's happening and help them understand the feelings in their brain, but also the physical surroundings that are around them and what people are doing and why they're doing them. Like that, I'm just so passionate about that, because I think just from my own personal experience of never wanting a kid to feel the way that I felt. So.
And looking at the time, we have time for maybe one or two more questions. So if anybody wants to ask something, they really want to get it in. Oh, all right, we have one from Megan. What is your favorite thing, activity, or program to do with the children and youth, both in person and virtual?
So I love Kahoot. I just love it. I love getting to be like a little game show host every single day. I think it's the best. And I get to learn. I know so many dumb facts about everything. I can kill it at trivia now because I literally create trivia quizzes. I create 10 trivia quizzes every single week. So I love that. But in person, and this is something we haven't really talked about, and it's very child lifey, I love medical play. Medical play is where often what we'll do is we'll have a little, we call it a soft cloth doll. It's like a plain human figured doll that's like plush. And what we often do is let them decorate it first so they can draw on a face, add hair, whatever they want to sort of make it personal to them. And then we're able to actually use real medical supplies and give their medical doll a IV, or we'll give them an NG tube, like a tube for feeding down their nose, or, you know, any sort of thing. Maybe they're getting a G tube because they're getting fed through their belly, and we're able to put that on the doll with them. And so even with the IV, like we're using a real needle very safely and securely, and all of the different things, and walking through and step by step. And sometimes we do that before it happens so they know what to expect in that way. We do a lot of like the 5 senses, like what's it going to smell like? What's it going to feel like? What am I going to see? But sometimes we do it afterwards too, to help them gain mastery of that experience. Maybe it was really, really traumatic for them to get that IV and they hate it, but we know down the line they're gonna have to get a bunch, or maybe they have a port here because they have cancer and they need to get treatment and they're getting a needle into their chest all the time. So we're gonna start doing ports in dolls, and it allows them to be in charge, in control. We can talk about like coping plans with them and be like, hey, does your doll want to look or look away during this? Does your doll want to be held or sit by themselves? Do they want to look at this book or an iPad while they do it? Or all of these different things we can do. Are we putting like a numbing cream on or no? Do you want freezing spray? No? Okay. And so we are able to sort of use play, because play is how children process their world. Play is how they learn. Play is the work of the child, and help them to cope. And I think it's fun and so empowering for the kids. So that's my favorite activity to do with them in person. And in our spaces, it's super cool because not a lot of places would do this. Normally it's a one-on-one thing to do medical play, but our spaces, we have child life specialists in our playrooms. So we would do group medical play. So then we have kids watching. We do one-on-one, but all the kids are watching, or they're like working on their dolls. So they're like seeing it like kind of in either parallel, because some kids are too nervous to do it for the first time, but they're observing. Other kids are like, oh, like I've done that before, or like when I do it, I do this, and they're able to talk and like support each other and share their ideas. I've had kids, like one kid was getting a PICC line, which is another way to get medication and do other things that they might need into their arm. And they were really nervous, and we were putting it into a doll, and the kid across the was like, I've had a PICC line before. It was like this. It wasn't so bad, blah, blah, blah. It didn't hurt at all. And like that, you can imagine how empowering and how much that would mean to a kid, because they're going to believe that kid 100 times more than they're going to believe me, an adult that works in a hospital. So that's my favorite.
Okay, so I think we have time for just one last question. So this one came from Emma. How was the TR program at Waterloo, and were the courses very difficult for you?
The TR program at Waterloo, were the courses difficult? I loved the program. I loved that I was able to do a university program that incorporated both practical and theoretical very much hand in hand. As you can tell, I'm a really hands-on person, but I do also love the like theoretical learning and like understanding behind all the work. I found the courses, I mean, it depended on the course. Some of them were easy for me. Some were hard. I hate writing papers. I'll be honest. I hate them. and I'm very glad I never have to write a paper ever again, hopefully. But any of those classes were really difficult for me. If it had multiple choice questions, for me, so easy. I love multiple choice, which I know is also a weird thing, but I think it just really depends on the class for difficulty. I would say I was definitely successful, and I was able to get good grades, but there were definitely challenges at times. Don't ever make me do stats. Also, I'm awful at math, like really, really bad at math.
All right, so just looking at the time, I think we're gonna end there. I wanna start by just giving a big thanks to Rachel for taking the time to have these office hours today. So thank you, we really appreciate it. And Rachel, would you be okay with sharing your contact info, maybe throwing your email in the chat if anyone wants to get in contact with you? Yeah, so if you have any questions that you didn't get the chance to ask, or maybe you think of them later, you can contact her directly. And then also, I know Ben needs to take a picture for social media, so.
Yeah, just like a nice little fun group picture, kind of a recap for the event. So yeah, pretend like we're all standing together. Yeah, so if you're comfortable, yeah, just leave your camera on or turn it on, and I'll just take a quick picture. I'll do a nice little countdown, and we'll go with that. Yeah. All right. Ready? Everyone smile. 3, 2, 1. One more. 3, 2, 1. Oh, that's my favorite thing. All right, awesome. Well, thank you.
I'm also gonna put the YouTube website. If you want to check out our YouTube, it is there.
All right, great. Thanks, Ben and Rachel. And one last reminder, there will be a survey that you all get emailed at the end of the session. It takes like 1 second to do. It's super fast. It's like a smiley face or sad face. So I'd love if you guys could just fill that out and give us feedback. Otherwise, yeah, thank you all for coming. I hope to see you all at our next office hours in March.
It was super nice meeting all of you, and good luck with all of your endeavors. I think you guys are in an awesome program at an awesome university, and I think you all do wonderful things.
Thanks, Rachel.
Thank you so much for talking to us.
Oh, no problem.
Thank you.
Thanks.
It's nice to see you.